Katie, and I'm going to demonstrate today how to put in a Foley catheter. I have checked my doctor's orders just to see what type of catheter to have. We're doing a female catheterization today, so typically it's a 14 to 16 French. In this case it's a 14, and it'll say that right on your packaging. Then we're going to go into the room, provide privacy. I'm going to perform hand hygiene, and I'm going to introduce myself to the patient and just say, hi, I'm Katie, and what I'm going to do today, I'm going to insert a Foley catheter into you today. I'm going to check patient identifiers, make sure it's the right patient, right room, and then I'm also going to check to see if they're allergic to anything that we're going to be using today, such as iodine, latex, tape, or the lubricant even that we put on the end of the catheter. What I'm going to do next is I'm going to uncover my patient. During this procedure, it is extremely hard to keep them completely covered. You need to have them exposed somewhat. Try to not expose them completely all the time. For demonstrative purposes, I will remove this blanket just so we can see the area we're working with. I'm going to assess their pain level, see if there's any abdominal distension. Then what I would do is I would provide pericare as necessary. She's good. While we're doing that, we would look for any drainage, swelling, anything like that. Next, what I'm going to do is I'm going to get my kit ready here. I'm just going to use the packaging it came in as a garbage bag and set that at the foot of the bed. Alright. And then we have our package. Oh, before I would do that, I would make sure that they're in the lithotomy position. If they can do that, I would assist them. If they can't keep their legs up like this, though, I would take and put them in a sideline position, and we could do it that way, but she's good like this. Alright, and then I'm going to open my package using sterile technique. Using my 1-inch borders. And I'm just going to use her foot here, kind of an anchor. I'm not going to worry about that. Alright, and I'm going to take my gloves and I'm going to lay them aside. We're not going to put those on quite yet. Then I have this here. I'm going to lift it straight up. I'm going to kind of shake it, and I'm going to get this side here without contaminating. I'm going to fold it if possible. There we go. Then I'm going to take that and I'm going to lay it. And if you don't get this right, it's not a big deal because we can fix it with our sterile gloves. Alright. Now that we have that, we can take this fenestrated drape. We're not going to use this. This is for males. We can take that and just toss it. Alright, and then I'm going to hand hygiene once more before I put on my gloves. Alright. Not perfect, but we'll get it fixed. These are really stuck together. Alright, get my other hand in here. some fingers here. If I had a lot of trouble like that, I would probably get a new pair, but. Alright, so now what I'm going to do is I'm going to move this whole kit here. Alright, now in this box we have our specimen container that we'll be using a little later. Then what I'm going to do is I'm going to open up my iodine. If I get some iodine on my hands, no big deal. Throw that away. Take all 3 out. Set them in. Alright, now we're going to open the lubricant. Pour some right on there. Throw it away. Alright, next what we're going to do is we're going to test our balloon to make sure that it's patent. And we can remove this as long as we have control of our catheter. Make sure it doesn't go flying all over the place. Toss that. I'm just going to set it back in the box. I'm going to grab my syringe. Alright, then we're going to just test it here, make sure that it's working. And it's working. No leaking, anything like that. Alright, we're just going to let that refill into our syringe here. And we are ready to insert. That's a lie. We have to clean. Alright, so taking our iodine swabs, we're going to go around. I'm going to contaminate my left hand here. And I'm going to go furthest away, front to back, around, and get rid of. Now we're going to go down this side, front to back, around, drop it. Now we're going to go down right down the urinary meatus, front to back, around. Now we're ready to insert. I'm going to keep this hand here. This hand is contaminated using my sterile hand. I'm going to go in and I'm going to get lubricant on the end of my catheter. And I'm going to insert. And you're going to keep inserting until you get urine return in the tubing. And once you do that, you're going to go another 2 inches, 1 to 2 inches. And once we get there, I'm going to let go my left hand off of here and hold about 1 inch away. And I'm going to take and insert the 10 mils into the balloon, asking my patient if they're feeling any pressure. Alright, now that I'm going to pull back a little bit on my catheter to make sure that it's in place, and it is. So then I'm going to take this, holding pressure, untwist, and I'm going to remove my gloves because these are dirty. And then we're going to take a Cath and secure it to the patient's leg around the mid-thigh. Secure that on. Oops. Oopsies. There we go. And then we're going to take and hook it just to keep it in place. Then we're going to take this. This we can take and hook to the bed to secure it kind of even more in place. And then you're going to hook this into the bed, onto the bed, excuse me. I'm going to wash my hands, clean up. I'm going to cover my patient, throw all this away. would check to make sure that he's getting good urinary output, good color. I would check the urine, make sure it was a good yellow color. Ask him if he's having any pain or anything like that. Now, he's been having this Foley for a while. The doctor has now come and told us that we need a urine specimen. So what we're going to do is we're going to go into the room and clamp the tubing. And clamp it for about a half hour, no longer than that, to get some urine backed up in there. What I'm going to do now is I'm going to wash my hands. I'm going to put on clean gloves. Expose only what we need to. Of course, I would do my patient identifiers and everything like that. And I'm going to take an alcohol swab, clean the port. Let that dry. And then I'm going to take a 3 ml syringe and I'm going to insert it at an angle and draw back 3 cc's or 3 mils of urine. Once I have that, I'm going to take and get my specimen container, keeping it sterile. Shoot, I should have grabbed it with my other hand. It's okay. And I'm going to slowly put my 3 cc's of urine in there. Cap that, keeping this sterile. Alright, I'm going to unclamp the tubing, let the urine flow back, take off my gloves, wash my hands, make sure my patient is covered, comfortable, and then I'm going to go on here and put the patient's name, my initials, the date, time, and how I collected it, and it needs to get to the lab within 15 minutes to be viable. And now the patient's ready to go home. She needs her Foley DC'd. So what I'm going to do is I'm going to discontinue it. I'm going to check orders, do my patient identifiers, and I'm going to hand hygiene. This is just a clean technique. Alright, we need to expose them like so. Trying to keep him as comfortable as possible. Alright, you usually would use some tissues. I'm going to use a Chucks. Alright, I'm going to set this kind of underneath. And I'm going to grab my syringe. Because you need to check in the nurse's notes how many cc's of urine you should be getting back in the tube. So I'm going to just take an empty syringe here, and in the nurse's notes I found that they put in 10 mils. So what you do is you just hook it on here, but you need to be holding this in place so it just doesn't go flying everywhere. So I'm going to twist this on, I'm going to grab it, and then it's going to start filling up. My needle was primed, so it should just come all right on out. Once we get to 10 mils, we know that all the sterile water is out. So what I'm going to do is I'm just going to kind of go hand over hand with the tissue. And then once we get to the end here, I'm going to put it in an upward position, and I'm going to make sure that everything is intact, that the balloon is there and the tip is there. And what I'm going to do is I'm just going to take this, would have had this off of here though, and I'm going to take all of this and dispose of it in a biohazard container. If there's a lot of urine in here, I would also empty this into a graduate and measure it, so I could mark it in my I&O. So I'm going to dispose of this in my biohazard. Then I would perform peri-cares as needed, cover up my patient, and I would monitor them and keep them on input or intake and output for the next 12 to 24 hours to make sure the bladder is emptying as it should. I would then put up my side rails, give them the call light, make sure they're in a comfortable position, ask them if there's anything I can get for them, and if they said no, we'd be all done.